Welcome to The Explainer. Today, we're totally flipping the script on how you probably view one of humanity's oldest known afflictions. We are demystifying the immunology of leprosy. We're going to transform what's often just written off as some ancient historical disease into what it really is, a fascinating, incredibly high-stakes battleground of the human immune system. Okay, let's dive right in.
To hook you right out of the gate, I want you to consider this mind-blowing time frame, 3 to 30 years. Mycobacterium lepra, the organism that actually causes leprosy, is an unbelievably slow invader. It has a generation time of up to 21 days, and that leads to a shocking incubation period that can last anywhere from 3 to 30 years before a single solitary symptom even appears. Literally, a person could be harboring this pathogen for decades, all while their body is silently trying to decide exactly how to respond.
Because this battle involves some pretty complex cellular interactions, here is our roadmap for today. We'll start with Section 1, the ancient slow invader. Then move into Section 2, the immune tug-of-war. After that, we'll cover Section 3, leper reactions explained, look at Section 4, pregnancy and luteal variations, and wrap up with Section 5, reading the immune memory.
Section 1. The ancient slow invader. Let's lay the groundwork for how this pathogen actually operates right from the moment of infection.
Before we really get into the disease itself, we have to talk about immunity. And in the context of leprosy, this is loaded with a brutal biological irony. You see, the cardinal signs of this disease, the skin lesions where you lose sensation, the severe nerve damage, they aren't actually caused by the bacteria destroying your tissue. No, they're caused by your body's own immune system violently reacting to the bacilla.
So, when infection happens, we hit an immediate crossroads. It often starts out as a subclinical stage. And from there, it can go one of two ways. For a lot of people, the body just silently heals on its own. No symptoms, nothing. But unfortunately, for an unknown number of others, it progresses into what's called indeterminate leprosy, and then blossoms into a persistent clinical disease. And the crazy part, the path it takes is entirely up to the host's immune system.
Section 2, the immune tug-of-war. Because you see, leprosy isn't just one uniform, predictable disease. It's actually a volatile clinical spectrum, dictated entirely by an internal battle.
We're really going to anchor on this crucial spectrum today. On one extreme, you have tuberculoid or TT leprosy, where cell-mediated immunity is exceptionally high. Then, on the exact opposite end, you have lepromatous or LL leprosy, where that immune resistance basically flatlines, and the bacillary load, the amount of bacteria in the body, just skyrockets. Ultimately, where a patient lands on this spectrum completely depends on whether they mount a Th1 or a Th2 immune response.
So, understanding these two opposing forces is absolutely crucial. Think of cell-mediated Th1 immunity as precise hand-to-hand combat. It activates cytotoxic T cells and macrophages to actively hunt down and kill the bacteria hiding inside the host cells. On the flip side, Th2 humoral immunity relies on artillery, specifically antibodies. But here is the massive catch. Mycobacterium leprae hides inside the macrophages. So those heavy-duty antibodies floating around in the bloodstream, they are completely, totally useless against a threat that's hiding indoors.
Taking this down to the cellular level is fascinating. In the strong tuberculoid response, the Th1 system rallies CD4 plus T cells to form these tightly packed granulomas, which successfully trap the bacilli. It's a great defense. But in a lepromatous response, the Th2 system basically downregulates or shuts off that defense. So instead of a nice strong granuloma, the body just creates these foamy macrophages literally packed with completely unhindered, rapidly multiplying bacteria. All while the body is furiously pumping out high levels of those completely ineffective antibodies we just talked about.
Section 3, leper reactions explained. So what happens when this incredibly delicate immune balance is suddenly disrupted, causing the whole system to just violently overreact?
Well, if a patient is stuck in the unstable middle of our spectrum, they can get hit with a type 1 reaction. Technically, this is a type 4 delayed hypersensitivity episode. At the microscopic level, a sudden dramatic shift in cell-mediated immunity triggers an absolute flood of inflammatory cytokines, like TNF-alpha. And clinically, that microscopic shift translates into gross swelling, severe nerve pain, and intense inflamed skin lesions on the body. It turns into an aggressive, localized war zone.
On the other hand, we have the type 2 reaction. You'll often hear this called erythema nodosum leprosum, or ENL. Now, this happens at the far lepromatocent end of the spectrum, where the bacterial load is at its absolute highest. Remember those useless antibodies? Well, they end up binding with the massive amount of bacterial antigens in the blood, forming what are called immune complexes. These complexes then get deposited in the tissues, setting off a type 3 hypersensitivity response. And that leads directly to crops of extremely tender, painful nodules erupting under the patient's skin, usually along with a high fever and severe full-body inflammation.
Section 4. Pregnancy and Lucio variations. This precarious internal balance is super sensitive to systemic biological shifts. Let's look at some extreme variations. Pregnancy is, naturally, a profound immunological event. To prevent the body from rejecting the developing fetus, pregnancy naturally depresses cell-mediated immunity. But for someone with leprosy, that tragically tips the biological tug-of-war in the wrong direction. It can severely worsen the disease, literally pushing the patient further toward the dangerous lepromatous end of the spectrum. And it gets worse. When immunity rapidly kicks back in postpartum or fluctuates late in the third trimester, these patients are at an incredibly high risk of suffering those severe, painful lepra reactions we just covered.
Now, another extreme variation caused by total immune failure is called Lucio leprosy. This is a diffuse, non-nodular form of lepromatous leprosy. In this state, the patient's defense mechanisms are completely deficient. There's basically nothing stopping the bacteria from multiplying. And when that massive, overwhelming load of bacterial antigen meets the circulating antibodies, it triggers severe vasculitis. This causes devastating necrotic skin infarctions, essentially tissue death, often seen clearly on the patient's extremities. It is a really brutal manifestation of the disease.
When you put the type 2 ENL reaction side by side with the Lucio phenomenon, the differences are pretty stark. Both of them involve heavy bacterial loads and antibody interactions for sure, but the presentations are wildly different. ENL brings those painful cutaneous nodules and generally less severe systemic symptoms, and if you take a smear, you'll see broken bacilli. The Lucio phenomenon, though, presents with severe ulcerative lesions without the nodules, much more intense constitutional symptoms, and entirely intact bacilli. That intact bacteria is a giant red flag, highlighting the total absence of any cellular destruction by the host's immune system.
Section 5. Reading the immune memory. Okay, now that we understand the incredibly high stakes here, how do doctors actually map out a patient's exact position on this dangerous spectrum? To figure out exactly where a patient stands, doctors rely on the Lepromin test. It's an intradermal skin test, meaning a specific reagent is injected just barely below the skin, usually right under the elbow crease. The goal here isn't just to see if a rash pops up. They are actively trying to read the body's cellular immune memory, to measure the patient's true underlying resistance to the bacilli.
Now, they use two distinct types of antigens for this. First is the Dermende antigen. It's made from purified fractionated bacilli, basically completely broken down parts of the bacteria. Because those proteins are already exposed, it triggers a rapid, early immune response. The second is the Mitsuda antigen, which is made from autoclaved, whole, intact bacilli. Because the body has to work to break those whole bacteria down from scratch, it provokes a much slower, delayed response. Waiting for these diagnostic results follows a pretty strict timeline. At about 48 to 72 hours, doctors can check for the Fernandez reaction. That's a quick read of existing delayed type hypersensitivity. But the real definitive proof of resistance, that takes time. Doctors actually have to wait up to 5 agonizing weeks for the late Mitsuda reaction to fully develop. A positive result there is huge because it confirms the slow, strong development of granulomatosis hypersensitivity, which is the body's ultimate weapon against the disease. Here's a really crucial takeaway, though. The Lepromin test is actually not used to diagnose the mere presence of leprosy. You don't use it to say yes or no to having the disease. Instead, its core uses are entirely for classification and prognosis. A positive Lepromin test is the ultimate indicator of cellular resistance. It firmly places the patient on the safer tuberculoid end of the spectrum. It proves their immune system can actively fight back, which directly predicts a much better overall prognosis for their recovery.
We've seen how the body's internal tug-of-war, this crazy battle between precise cellular defense and misguided antibody production, entirely shapes this ancient affliction. Leprosy isn't just some historical curiosity from the past. It's literally a live map of human immunity. Which leaves us with one profound final question to chew on. If leprosy so perfectly models our delicate immune balance, what else can this ancient slow invader teach us about curing the complex immune diseases of tomorrow? Thanks for exploring with us, and keep questioning the science.